Emily, we so welcome you to be with us. And probably there's no greater think tank around than the American Family. And so we welcome you to help us think this through this morning.
Thank you very much, Peggy. It's a pleasure to be here today. As Peggy mentioned, my name is Emily Feinstein, and I'm the Senior Policy Analyst here at Casa Columbia. I've spent the past 4 years focused on issues related to teen smoking, drinking, and other drug use. And today, we're going to focus on why teen substance use is such a critical public health problem, and importantly, what parents and other adults in teens' lives can do to prevent it. The reason teen substance use is seen as a critical public health problem is that it threatens the health, safety, and future of our youth. Contrary to our obligation to protect teens from health and safety risks, American culture actually drives teen substance use. And by culture, here I mean the sort of behavioral examples, messages, and norms that tell us what behavior is acceptable. In addition to these cultural messages that hike the risk for all teens, some teens have specific biological factors or individual life characteristics that increase the risk that they will use or become addicted when they do. And last, teen substance use can be prevented through traditional public health interventions that are designed, for example, to reduce access to these substances, to change behaviors, and to get help for teens who need it. So teen substance use is a public health problem, but addiction, clinically defined, is a medical condition. The science has helped us to understand that addiction is a complex brain disease that's characterized by structural and functional changes in the brain that disrupt normal brain processes. So it becomes manifest as compulsive drug seeking and use, despite serious social and health consequences. And oftentimes, addiction co-occurs with other mental health and medical conditions. About 16% of the US population ages 12 and older suffer from the disease of addiction. But what's important to note is that in most cases, addiction begins during the teen years. What's really we're going to talk about today is why adolescence is a critical period both for initiating substance use and for the risk of developing addiction. Science has been able to help us to explain why this is. And here you see MRI scans of the human brain, which allow us to map the brain as it develops from childhood around age 5 through early adulthood. And it's important to note that the human brain develops into the early 20s as late as 25 for some individuals. Now, the blue sections in this scan show the maturing parts of the brain. And as you'll see, the maturation process begins at the rear of the brain and works its way forward through adolescence into adulthood. And the front of the brain is the last to develop. This is the prefrontal cortex. The prefrontal cortex is very important for executive function. It's the term that we use for judgment, decision-making, appreciating long-term consequences, and impulse control. And as you see, that part of the brain develops nearly last. This fantastic ad from Allstate sums it up. Why do 16-year-olds drive like they're missing a part of their brain? Because they are. As we saw in the last slide, the prefrontal cortex is still developing in teens. And because the prefrontal cortex governs judgment, understanding consequences, and impulse control, teens are more inclined to taking risks, including the risk of experimenting with addictive substances. So this period is sort of what we call a perfect storm. During adolescence, because the brain is developing, teens are more inclined to taking risk. But at the same time, because the brain is developing, it's more vulnerable to the damaging effects of addictive substances. So this makes teens at increased risk of becoming addicted when they use. The epidemiological evidence shows that there's a strong link between age of first use and suffering from the disease of addiction. 90% of individuals with this disease began smoking, drinking, or using other drugs before the age of 18. It's really important here for me to note that it's not just people who suffer from alcoholism began drinking before age of 18. All substances affect the brain in similar ways. They all affect the reward pathways and increase dopamine in the brain. The use of any one of nicotine, alcohol, or other drugs increases the likelihood of use of other drugs and increases the likelihood of addiction to any of these other drugs. And here you see some data that shows that the earlier teens begin to use, the greater the likelihood of addiction. And the converse is also true, and this is very important for parents to understand. Every year that first use is prevented and delayed, the risk of addiction goes down. So here you see our data, which shows that individuals who first use tobacco, alcohol, or other drugs before the age of 15 are 6.5 times as likely to have addiction as those who first used at age 21 or older. How big is this problem? Well, when we looked at high school students, we found that 75% have already used one or more addictive substances before they graduate. This includes here tobacco, alcohol, marijuana, and cocaine. And 46%, nearly half, have used one or more in the last 30 days. We call these current users. So, adolescent substance use on its own is actually more prevalent than many of the other serious public health problems that we talk about related to teens, including obesity, bullying, depression, and anxiety. So what drugs are teens using? Well, by and large, the number one is always alcohol, with about 72% of high school students having ever used it and 40% having used it in the last 30 days. Cigarettes and marijuana are second, and we see that the lifetime rate of cigarette is still higher, but when we look at marijuana use, and this data is a little bit old, we're seeing it even more today. More teens are current users of marijuana than of cigarettes. Fourth on this list, not shown here, is controlled prescription drugs. About 15% of high school students have misused a controlled prescription drug to get high. And really important to note is that among high school students who have used these substances, the average age of initiation is between 13 and 14 years old, which is well before that 15-year-old age mark that I told you about. The consequences of adolescent substance use include serious academic, health, and social consequences. I'm going to talk a little bit more about academic and health consequences, but on this slide, I just want to point out that teen substance use is associated with risky sexual activity, which includes unprotected sex and multiple sex partners, and can result in sexually transmitted diseases and unplanned pregnancies. It also puts teens, especially alcohol, at risk for sexual assault. Teen substance use is particularly associated with academic consequences, and here I want to point out it's not just poorer grades, which it is, but also increased likelihood of dropping out of high school, decreased likelihood of graduating from college, and there's evidence that shows that teen substance use, especially use of illicit drugs, is associated with long-term career effects, including increased likelihood of unemployment, decreased benefits, and career advancement. And in part, these impairments in learning and academic performance can be attributed to the direct effects of tobacco, alcohol, and other drugs on the parts of the brain responsible for learning, attention, and memory. Teen substance use is also associated with a list of mental health and behavioral disorders, including anxiety, depression, and suicide. And these disturbing consequences are associated with all of these drugs, including nicotine, alcohol, marijuana, and controlled prescription drugs. And last, teen substance use is associated with the 3 leading causes of death amongst teens, which are accidents, including motor vehicle accidents, suicides, and homicides. But as I mentioned earlier, addiction is one of the consequences of teen substance use. And already before graduating from high school, 11.9% of high school students meet the medical criteria for addiction. When we look at that 75% who've ever used alcohol, marijuana, tobacco, or cocaine, we see that almost 1 in 5 meet the medical criteria for addiction. And when we look at that 46%, the current users, those teens who've used in the last 30 days, already a third of them meet the medical criteria for addiction. So what is driving this problem? Well, as I mentioned, American culture is rife with messages that promote teen substance use. These messages are coming from the family, the home, the school, the environment, the media, other teens. But for the most part, these messages are created by adults. The first place where teens receive mixed messages about substance use is the home. Parents themselves send mixed messages with their beliefs and their behaviors. So for example, we found that almost half of high school students live in a household with a risky user. A risky user is somebody who smokes or uses tobacco, drinks in excess of the U.S. dietary guidelines for safe alcohol use, or uses controlled prescription drugs to get high, misuses them, or uses illicit drugs. In addition, in our survey, when we talked to parents, we found that 1 in 5 parents think marijuana is a harmless drug. And last, it's worth noting that one of the primary sources for these substances for teens is home. Another source of these mixed messages is the school environment. In our teen survey this year, 60% of high school students told us that drugs are used, kept, or sold on their school grounds. Lack of funding, lack of evidence-based prevention programs, and a failure to look at this as a healthcare problem really lead schools to miss an opportunity here for prevention and early intervention. When we surveyed high school personnel, we found that only about a quarter of school teachers say that their schools trains the staff to know how to identify this problem or to know how to respond when they see it. And about 3/4 of high school teachers were unable to name a professional to whom they should refer students who have a substance problem. We also asked schools what would they do if they found a student who was smoking or drinking or using other drugs. And the number one response was to suspend the student. So basically, they send the kid home to play video games and smoke pot all day while their parents are at work. This is not helping the child at all and not addressing the situation as a healthcare problem. We see fewer schools would suggest counseling, and at the right, you see the least number would refer the student to a healthcare provider, which is ideally one of the first things that they should do. And the media. Every day, teens are bombarded with messages from the media that make smoking, drinking, and drug use seem glamorous and relaxing. I mean, look at this Cuervo ad. Who doesn't want to be those people in that ad, especially if you're a teen? Unfortunately, the research really shows that these messages are not benign. Exposure to images of smoking and drinking in entertainment media like television and movies and in advertising is increased to teens' initiation of substance use and to their escalation of use. And I should also point out that even though we do have some regulations, a lot of these images are occurring in the very shows that are appealing and marketed to teens, including movies that are rated PG and PG-13. However, R-rated movies are certainly the worst. And when we did our teen survey, I think about 2005, we asked about watching R-rated movies. And teens who tell us that they watch 3 or more R-rated movies a month are more likely to have tried tobacco, alcohol, and marijuana. So it's really important for parents to know what their kids are watching. An increasingly new form of media is the internet. In the last 2 years, we talked to teens in our survey about their use of social networking sites like Facebook. And this year, 46% of teens told us that they've seen pictures on these sites of other kids getting drunk, passed out, and using drugs. And 2 years in a row, we found an association between teens' exposure to these images and teens' own substance use. This year, we asked teens a little bit more about this correlation, and 75% of teens told us that they think when teens see pictures of other kids partying with alcohol and marijuana, it encourages teens to want to do the same. Another way that our culture promotes substance use is the ease of availability. Once the desire is primed in teens, they have very little trouble accessing these products. I often joke that if an adult ever wanted to get high, the first thing they should do is ask a high school student, because high school students know where to get it. And here you see a survey of 10th graders, how many of them say that it's very easy for them to get cigarettes, alcohol, and marijuana. But another really important thing to mention here again is that one of the key sources for teens for these substances is their friends' homes and their own homes. So it's the family medicine cabinet and the family liquor cabinet. And these mixed messages that teens receive from the larger culture really impact teens' expectations about substance use, their ideas about substance use, and their own behaviors about substance use. Particularly when teens believe that their peers are using or are particularly accepting of use, teens are more likely to use. Unfortunately, teens tend to way overestimate the extent to which their peers are using. In studies, one study said that teens overestimate peer marijuana use by 4 times. So you'll always hear teens tell you that everyone is using, and that's sort of the way they see it. In addition to these cultural factors that influence the risk that all teens will use, some teens have particular biological factors or life circumstances that increase the risk that they will use or become addicted. I mentioned age of first use as one of the issues. Another is genetic predisposition. Genes actually influence both the age of initiation and initiation of use and the likelihood of addiction. As much as 50 to 70% of addiction can be attributed to a genetic predisposition. Suffering from adverse childhood events is another big risk factor. This includes trauma and abuse and neglect. Another is having a co-occurring mental health or behavioral disorder like anxiety, depression, or ADHD, and then being victimized or bullied in other ways. And then last, there are some teens that we call sensation seekers that are just engaged in a lot of risky activity, and these teens are also at increased risk of substance use. And there are particular times and places where teens are more likely to use. One of those times is puberty, especially early puberty and especially for girls. Another one of those times is the beginning of any school when teens are suddenly exposed to older students and their norms and beliefs. So this includes middle school, high school, and college. In fact, I just saw a study that said that the predominant percent of alcohol-related injuries that happen to teens in college happen to freshmen in that first month of school. So this is always a risky period. Also for teens, dating an older boy, especially for girls, as I mentioned, schools where drugs are used, kept, or sold. And last, parties without parents. This is really important. When teens say that they attend parties where there are no parents attending, drugs and alcohol are 15 and 16 times more likely to be present. So it's really important for parents, when their teen is going to a party, call ahead, find out if the parent's going to be there, set a rule that you can't go to parties that aren't chaperoned by adults. It's not popular, but it's an important thing to do. So despite all of this doom and gloom, it's important to remember that not all kids are using, and the research has identified a number of factors that mitigate the risk that teens will use. These include having a positive family environment with engaged parents, and we're going to talk a lot about parental engagement in a minute, but having also other positive adult role models in the teen's life, having positive relationships with community and the school, and being engaged in extracurricular activities, having religious sense of spirituality or religious involvement, and also a strong sense of self-esteem and impulse control. From a public health perspective, we look at the measures to prevent public teen substance use as one, helping the public understand the risks with teen substance use, and especially those risks that we talked about earlier, where early use is associated with increased risk of addiction. Second, especially this is important for parents, we need to prevent or delay the onset of use as long as possible while the teen brain is developing. And we need to identify those teens at risk, as we spoke about, those biological and life circumstance risks, and monitor those teens more closely. We need to intervene early with teens who are using. For example, healthcare providers can do screenings of brief interventions in the healthcare setting with these teens. And last, very important, we need to provide appropriate treatment for teens who have symptoms of addiction. So what can parents do? Prevent, delay, but how? Well, the key to preventing teen substance use and raising healthy drug-free kids is parental engagement. At CASA, parental engagement is a term that we use for a cluster of parenting practices and norms that the research has identified as being associated with the reduced risk of teen substance use. I'm going to talk in detail about these 9 facets of parental engagement you see here, but on this slide I just want to point out the importance of getting dad engaged. If dad is involved in the teen's life or the child's life, it's important that dad be engaged fully and especially on board with mom in messages about teen substance use. And also, parents need to engage with the larger family. The larger family is the community in which you live, your teens, friends, parents, other parents at the school, and the school itself. First, let's talk about being there. What does being there mean? Well, first of all, monitor your children's TV shows, movies, games, and music. As we talked about, the media is a really big influence on teens. It's important to monitor what your children are watching, set limits, and certainly talk to your kids about what they're seeing. Secondly, monitoring your children involves knowing how they're doing. How are they doing in school? How are they doing emotionally? When you see signs of depression or anxiety, it's important to get help that they need right away. And last, just simply being involved in your kid's life and knowing what's going on and being a source for your teens of advice, which brings us to opening the lines of communication. It's very important to remember that you need to start talking early, before the teen years. And you need to start talking to your kids just generally about what's going on in their life so that these conversations become routine when they do hit the teen years. And of course, in these conversations, you want to talk about substance use, the risk of substance use, and your expectation that teens will not use. Again, as I mentioned earlier, it's very important here for mom and dad to send consistent messages. Our research has found that when mom and dad are inconsistent, teens are more likely to be drinking and using marijuana. How do you bring up substance use? People often ask me this. When do I talk to my kid about it? Well, all around you, you're going to see what we call teachable moments. These are opportunities from things that you see in the media or walking down the street. Maybe someone smoking a cigarette. Maybe someone at a dinner party drinking too much. Maybe it's just Lindsay Lohan in the news again. These are opportunities to start a conversation with your teen. What do you think about that? Do you see this going on at your school? Why do you think people do this? What do you think it does to the teen brain? And have a real conversation. The last point, which I'm going to pull up here, is really remember that communication is half listening. It's really important for teens to feel that their parents listen to them. And last, stick to the facts. Your kids are going to hear exaggerations on both sides about the harms of substance use and about the fact that there are no harms of substance use. So it's really great if you can become a credible source of information to your teen. Along those lines, the next question we always get is, what do I do when my teen asks me, Mom, Dad, did you ever use drugs? First thing we say is take a deep breath. This question is not really about you. It's really about your teen and what they're going through and the decisions that they're going to need to make in their life. So maybe find out why they're asking. Did they discover that one of their friends' parents smokes pot? Or did someone say, hey, everyone smoked pot in the 70s. I'm sure your parents did too. And then secondly, be honest. As I mentioned before, you want to be a credible source of information, but you don't have to tell your kid everything. Same way as if you were talking about your sex life, tell them the information that's relevant. You don't have to brag about how you loved getting drunk in college. If you had negative experiences, certainly share those or the negative experiences of your friends. But more importantly, know that you know a lot more now than we did then. The science has really shown us a lot about the damaging effects. I think those of you who are involved in this last month saw the effects of alcohol on the teen brain. And you can talk about the science with your kid and tell them, look, I didn't know this when I was a teen, but now that we know it, I would not have made those choices now, and I expect that you will make different choices now. Set a good example. Teens and children are influenced as much by what you do as by what you say. So it's really important to set a good example with your own behavior. If you smoke, quit, even just attempting to quit sends a really good message for your children. Certainly don't misuse for controlled prescription drugs or illicit drugs, and don't drink excessively around your kids. Our survey of high school students, teens aged 12 to 17, showed us that teens who've said that they've seen their parents drunk are more likely to have used marijuana and more likely to be getting drunk at least monthly. And getting drunk at least monthly for a teen means binge drinking regularly. Set rules and expect your children to follow them. Children aren't born knowing limits. This is something that they learn through trial and experience, and it's really important for parents to teach them this by setting sort of a safe scaffolding around them and allowing them to push a little bit, but having firm limits on acceptable behavior. You do this by explaining what the rules are, explaining what the consequences are when children break the rules, and then enforcing them. So for example, when your daughter is going to a house party, you say, look, we've talked about alcohol. It's damaging for teens. It increases the risk of addiction. It's illegal, and you're not allowed to drink. So I hope you have a good time. If you need a ride home, call me. But remember, if you do drink, I'm going to take away the car keys for a month. And then if you find evidence that your child is drinking, enforce those consequences and teach them so that they start to learn appropriate behavior. The message here really for parents is to be a parent and not a pal. Another important thing to know is that teens really don't want to disappoint their parents, and so your expectations are very influential. When we ask teens how upset their parents would be to learn that they'd smoked, drank, or used marijuana, most teens say their parents would be extremely upset. And these teens who say their parents would be extremely upset are also less likely to have smoked, drunk, or used marijuana themselves. And also when we ask teens why their friends don't use, the number one response is always because their parents would be disappointed. And the number two response is because they don't want to get in trouble. So parent expectations are really powerful. Another influence on teens' lives that appears to be very positive is religious attendance. We found that teens who attend religious services at least 4 times a month are less likely to be smoking, drinking, and using other drugs. Attending church or synagogue or other religious services together is a wonderful opportunity for parental engagement. Hopefully, mom and dad together if possible, in car, on the way, having conversations, talking about afterwards what you heard, and basically bonding with your children. The other wonderful opportunity for parental engagement is family dinners. Our research has consistently found that family dinners are associated with a decreased likelihood that teens are smoking, drinking, and using other drugs. The family dinner, this is the perfect opportunity to get in touch with your kids, to be there, to know what's going on in their lives, to talk to them about school, to have these teachable moment conversations, and generally foster a strong supportive environment with your kids. When we ask teens about their thoughts on family dinner, teens by and large always tell us that they love it, they appreciate it, they wish they could do it more, and the thing that they value is not the food, but the conversation that happens around the table. Now, of course, not all families have the time or the opportunity to have frequent family dinners. And there are other opportunities where you can have these kinds of conversations and bonding as well. It could be breakfast, if you make breakfast your family meal. It could be driving in the car. My mother told me when I was a kid she would volunteer to drive me everywhere because that was the only time I seemed to talk about what was going on at school. Family outings, whatever it is, you can be creative. It's just important to have a ritual and a routine where children know that right now what's going on is that you're connecting and communicating together as a family. Because we believe Family Dinner is such a great opportunity for parental engagement, we celebrate Family Day, a holiday that comes every fourth Monday of September. This year, Family Day is going to happen soon on September 24th. Last year, President Obama, all 50 governors, and about 1,000 local officials joined us in proclamating Family Day, and we hope that you'll join us this year in celebrating Family Day. If you'd like more information about Family Day or tips on what to do for fun family dinners, also other advice for parents like signs and symptoms that your teen might be using or how to talk to your children about drugs and alcohol, log on to our website, www.casafamilyday.org.
It's fabulous to hear your research and to hear all the things you've done about it. And when I think about Family Day and eating dinner together is just phenomenal. This September 24th, and you have all of those people across America eating dinner. I mean, what are some of the tips that you say to parents?
Some of the tips we have include ways to involve children in the family meal, so ways to help get them involved in making dinner or choosing the menu. Other tips are about conversation starters, ways to get the conversation started. You know, really ideally at Family Day, we want parents to be connecting with their kids, getting engaged and learning more about what's going on in their lives. So we have tips for how to make this fun and easy for parents.
It looks like we're coming to the end of this, and I would like to add thank you again, Emily, for the research. Thank you, Casa. We really appreciate it. Thanks to each of you, all 200 of you out there, and we hope you will take our message and spread it. And remember, it could be my grandchild that you're delivering some nice little message to. We don't know. We are each other's keepers. And I think that we have the information to try and do that. And so thank you, thank all of you, and thank you for participating with us.